Hello everyone, this is Tobroni here, and welcome back to some more Surgery Squad games. I did oh gosh, excuse me, I'm running out of breath for some stupid reason. I liked the old episode last time. It was a good, and great episode. Well, at least for me, and I figured, why not do more of this? It's been about a month, figure why not get back into it. And this one is the braces ones this time. If you guys, for those of you who don't know what braces are, I'm sure most of you know who are, but these little train tracks in your mouth actually help your teeth get in place, because it seems that your mouth just says, hey, do this and this and this, and the teeth's like, okay, and then you have to bring these machines in, and they're like, nope, ain't gonna happen. I actually, for those of you who don't know, I actually got braces. I already had braces, like when I first started.
Welcome to Surgery Squad.
Hi.
I'm Dr. Jeff.
Hey,
and
Jeff.
Today we're going to talk about braces, those fantastic bands and wires that help straighten out crooked teeth. Let's face it, most of us do not have perfect teeth. Everyone's smile is unique. Some people's teeth are just a little more out of shape than others. Your teeth might be crooked, or your upper and lower jaws might not be the same size. If your upper jaw is bigger than your lower jaw, that is called an overbite. If your lower jaw is bigger than your upper jaw, you have an underbite. Sometimes your mouth is not large enough for all your teeth. That is referred to as overcrowding. In all of these cases, the problem can be fixed with braces. Braces are a series of brackets, wires, and bands that are used to guide your teeth back into the correct position. This improves looks, makes it easier to chew, and at times even improves speech. Our patient today has what looks to be an overbite. We want to see how noticeable it is. We'll start by getting a record of the current state of her teeth in many ways, including x-rays, impressions, and photographs. We'll start by taking some x-rays.
Whoa. Okay, your mouth it doesn't seem to be that messed up. Okay, to get a picture of this.
Next, we'll take an impression of the teeth. We put a special gel on the bite mold. The gel comes in lots of terrific flavors, like candy cane and chocolate cake. Can you put the mold in the mouth?
Of course I can. Alright, there we go.
Great job. We'll have my assistant make the bottom impression. Once we have them both, we'll use the impressions to make a plaster model of the patient's teeth. Okay, we've got our impressions and x-rays, and we can see that our patient needs braces. I've also taken some photos for our before and after wall.
Maybe down
we'll
here.
arrange an appointment for next week to put the braces in place.
Also, looks like she needs to brush her damn teeth. It's like those quick timeline musics that's just like...
Our patient is back, and we're ready to put on her braces. In some cases, a patient may need spacers placed between the teeth for a week to create more room for the bands. Our patient does not. We'll start by polishing all the teeth. Making sure there is no debris on the teeth will ensure that the braces adhere better. Run the polisher over the teeth to clean them.
Yeah, they're horrible. For those of you who...
Wow, what a marvelous job. I can almost see myself in those teeth.
I didn't do anything.
We need to put on some molar bands to anchor the braces. They circle the whole tooth and have a hook on the outside of the tooth. Slip the molar band over the tooth.
They're ugly.
We'll cement it into place later.
I didn't do anything. I thought it said continue. I thought it said continue, like it was just close I can actually do. I didn't know it actually could skip that. We're sorry, but I guess your teeth are awful now. For those of you who don't know, I used to have braces. I kind of do now, but now I have retainers. I don't have it in my mouth now. I should. But I used to have braces when I was like when I first started this channel, or even I think I already had braces when I started this. I'm not too sure.
Great. Now we can start putting the bonded brackets on the rest of the teeth. We've placed a lip guard over the teeth to give us room to work. Let's rinse off the teeth. Can you spray them with water? I run the suction to remove the water.
Okay, I'm not gonna click continue this time. Will we? Oh, I hate this. It's just the sound. It's just the... Oh, jeez. It's the feel of when you get, like, those... It's like when you go to the dentist and they have to clean your mouth. And how it's cold water. And how you just, when you feel that coldness, you feel that freezing pressure under your teeth that just feels awful. It's like you can feel the cold in there, and it's just when you get the air out, you feel like when they blow it out, it just feels horrible.
Let's spray some air to get the teeth nice and dry. Can you handle that for me?
It's just, it feels completely weird. Oh, it was just a suction tube. It feels weird when you feel like every little what the heck is wrong with your eye? Well, it just feels so. It just hurts your jaw when you have the wind.
With the teeth dry, we'll now put a small amount of bonding agent on the teeth. Wipe a little bonder on each one.
Oh, jeez. Okay. I used to have braces, and a lot of kids, a lot of people that are like in their teens and such, or 20s, have to get braces, cause apparently my mouth wasn't really perfect either for some reason. And actually, you get these for 2 years. I just keep clicking non-stop. There we go.
We let the bonder dry for a minute or two so that it is sticky. Then we place a bonded bracket onto it.
Alrighty then. I could just do this. I don't need to. I could just slam them on. Oh, forgot you, dude. Come on. Everybody in line. Everybody in the club. Come on now. Get on board.
I will scrape off the excess bonding agent with a dental pick. Now use a curing light to harden the bonding agent under the brackets. Click to turn on the curing light.
Click what to turn on? Oh. Oh, this is the light. Okay, why are we lagging? I don't like the lag. Alright, I guess we're good.
Great job. Now I'll put the bonded brackets on the rest of the teeth. There we are. While I was at it, I readjusted the molar bands and cemented them. We're ready to place the arch wires. The arch wire is a thin wire that connects all of the teeth by going through each bracket.
These are the train
Let's slip the wire into the brackets of the bands on the molars. Move the wire to the mouth to put it in place.
I know. This isn't actually that quick as you think it is. This seems like, like a simple, 8-9 minute thing. No, this takes long. This is like literally a full 2 hours. Like, even just like putting the mold in, that's just simple, quick, and easy. But doing this takes like 2 hours to get in and out of. Literally. There we go. Now you got train tracks on your teeth.
We do not want the wires to poke our patient, so now that they are all snapped into place, I'll reduce the ends by clipping them off with pliers. And there we are. The arch wire is in place. Now we'll use elastic ligatures to make sure the arch wire does not fall out of the band. The ligatures are little rubber bands we snap over the front of the bonded bracket using a different pair of dental pliers. Now you try. Place the ligature over the brackets indicated.
What the heck is this? I can just click non-stop. It's like magic. It's like boop, 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 boop. Well, I guess good thing we got pink, because I guess you're a girl. If it was blue, then she would just scream. Get it?
And with the last ligature in place, our patient is done for today. In the next few days, she might experience some initial discomfort. She should plan on eating soft foods and taking over-the-counter pain relievers if needed. Orthodontic wax can also relieve discomfort. If there is a real problem, she can always call the orthodontist.
Of course.
It is important to take more time brushing and flossing when you have braces, as food can get lodged between the wires and the teeth.
That's true.
Our patient will have regular appointments about once a month for the next 6 months, and then space them out after that. The treatment usually takes about 1 year with braces, and then additional time with a retainer. The true length will vary by patient. She might also need additional equipment such as elastic bands, coil springs, or headgear. We will not know until we see how she responds to the braces.
See, got retainers.
There you have it. The braces are in place, and our patient is on the way to a beautiful straight smile. Thanks for coming by Surgery Squad. Why not check out one of our other procedures here on SurgerySquad.com?
But she'll look like a nerd though, because she'll be like, hi, hi, hi. Okay, not really that much of a nerd, but you get the idea. What the heck is this? We got like an eye surgery? A breast cancer surgery. Maybe another day. Alright, I'm gonna go to a different game. Don't know what the heck I'm getting myself into, but it seems to me that we got an ingrown toenail surgery. I mean, an ingrown toenail removal. This is the one where it's like if you don't wear the right shoes or your feet just want to be a complete DICK to you, and then it seems to be that your foot acts all weird. Actually almost had this. I came really close several times from getting these about a couple up to 2 years ago, and I mean, but I could just like suddenly, like exactly on this toe right here, like right where it's digging at, it's the exact same size, or like on the exact same foot that actually got an ingrown, almost got an ingrown toenail actually. But I was just, I would feel like some real plane, and it was like flat and a bit reddish in some of the others for some reason, and luckily it just went away quickly, because this ain't fun when you get an ingrown toenail, and this is just horrible, and you're gonna see why. You're gonna exactly see what I'm talking about here. This is just gonna be icky. Surgery Squad.
Hello, and welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff,
I know,
and I will be guiding you through this procedure today. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose.
I thought you were going to get a cartoonish thing of it.
Injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain, but remember that you should never attempt to remove an ingrown toenail yourself. If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one. Our patient is ready, so let's begin by disinfecting the toe.
I didn't think you were going to actually show an actual real-life picture of it, but I was just going to do like a cartoon show of it. I mean, a cartoon picture of it. Alright, so let's do this. Wait, hang on. Wait, let's just get all of this. There we go. Wait, let's just do your whole toe. Lag, go away. Never before have I had a game such lag. Especially on a web browser game. This is just, it's just stupid. Quit the laggy, man. You know, I'm just gonna do like your whole toe. A whole toe, man. The whole thing. Good lord, there's lag everywhere. Gonna do your whole toe. Gonna get you like a nice new paint for your skin. Looks like he's been eating too much cheese, or he just dipped his whole foot in some cheese. If you know what I mean. No, okay, not that. Don't look at it like that. Just making a silly joke out of it. Nothing to be sexual about it. Sheesh. Okay, this is enough. This is getting completely ridiculous. I mean, just... Okay, well, good.
Now, we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe.
I still see the different paint. Like the different colors, like over here it's all color-ish and here it's just different. Like so, oh, there's little circles here. Okay. Poke. That is disgusting. That's gotta hurt, man. Oh, jeez. Owie!
Great. Now we'll wait a few minutes for the toe to get numb. Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. Once you've done that, we can move on to removing the ingrown portion of the toenail.
Alright. That has gotta hurt though, to have it get a needle on your toe, or at least one of your toes. That's gotta hurt. That's gotta be like the worst spot ever. Because of how thin and little the skin is.
First,
though.
Carefully slide one blade of the nail anvil under the affected nail.
Oh my goodness, am I gonna cut its nail off?
We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail.
Oh! Of course he's gonna feel some damn pressure. Oh god, are we gonna... Oh! Ah! Oh! Oh gosh!
Great! Take the forceps and carefully remove the ingrown nail.
Yeah, get it out. Oh gosh. Oh.
It's getting kind of messy in there. Let's clean up that blood.
Oh man.
See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe to get as much of that infection out as you can.
Oh jeez. Oh. Icky. Shh.
That toe is starting to look much better, but we're not done yet. Next, we're going to apply some phenylacid to the wound. This will help ensure that the problem of ingrowth will not reoccur in this toe.
Oh.
When you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
Ah.
Finish by applying some antibiotic ointment on a sterile gauze pad.
Okay. Hey, it even says Dr. Jeff. Did you create this stuff?
And wrap it in a gauze bandage.
I'm not doing it. The game's doing it for me now, I guess.
Fantastic job.
Yay.
Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics.
Yes.
We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day. While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail. You did a great job today.
Yay.
While you're here, try your hand at one of our other surgeries here at SurgerySquad.com.
Okay then, well that's all for now for this video. Oh, that was disgusting how it showed like his skin, the skin covering over the nail. I did not know it wouldn't grow back. Well, at least I have all of my feet in place. Oh man, god damn. Oh, so I mean one boots that's actually one time during one morning I had it was like a bad morning because I went over to like help lift something up that was actually too heavy, and my family came in to help, and I remember it slammed on my toe, and it really hurted. And but now it peeled off, but now there's like a new one coming back in. I don't know if you guys can see, but there's actually like a new one getting back in there. It's actually almost done, which is actually surprisingly nice, and I'm glad I didn't get an ingrown toenail, so I'm glad my body's still in good condition. But oh man, that was just horrible to take that poor man's nail off. Oh man, oh how disgusting that was. Alright, we got the child. Over here we got childbirth, and then we got an even more disturbing one. Dr. Jeff, remove it until they actually fully. Okay, I'm just gonna do. Alright, I'm gonna leave this video here for now. I am definitely gonna do more of these games. The link in the description for you guys to go play. Alright, we should go to this website will be in the description below for you guys. Cause I don't really want to leave 2 links, cause I think it would just be simple and easy just to do 1 link, and you guys can, you know, find it yourselves, cause it's in this website here. And so yeah, that's pretty much it for this video. It's just, I don't know how long it may take, but I know it's gonna be much quicker than the other games I play, cause I didn't really have time really to do this. And I hope my dad doesn't work graveyard tomorrow night, because it's not only is it a school night tonight and I have school on that day, but if he works graveyard it would really suck, because then I would have to try and think of something simple and quickly as well, because again I can't really do big games now on that night because of how much, you know, because it'll just take too long, and I can't just stay up all night waiting for a video just to be done uploading, to have it fingers crossed, you know, it will work, you know, I can't depend on that. But for now, thank you all so much for watching. If you liked this video, leave a like, leave a comment, hit subscribe for more, and I'll see you all sooner or later. Bye bye.